the folk in this room are leading organisations to cope with. Introduce you now to Ronnie Todaro, who's there. Ronnie leads the National Programs of Parkinson's Disease Foundation. She has years of experience working with people in industry, government, academia, research professionals, and not-for-profits. So I'm sure you'll want to catch up with her later on and find out how you can successfully do that or improve on how you do that. She's going to talk today about Parkinson's advocates and research. Over to you, Ronnie.
Okay, good, good. And everyone's able to hear me? Great. How's everyone doing? Great. Good, okay. I know it's getting to be that time of the day. You know, it's 3:02 exactly. We're heading into the end. And what I'm going to do for the next 10 minutes or so is talk to you a little bit about the work that we do with the Parkinson's Disease Foundation, a division of the Parkinson's Foundation. Now, this is the first time I have publicly been on stage actually saying that sentence. As I'm sure everyone in this room may know, is that the Parkinson's Disease Foundation, as of August, has merged with the National Parkinson's Foundation. And it's so exciting to be here today at the beginning of the WPC to say that, and just to say how exciting it is to see these two national organizations come together, and it's really just amazing to think about what we're going to be creating in the future moving forward. So, and I would also, if it's okay, take a moment and ask my colleagues in the room who are with the National Parkinson Foundation and the Parkinson's Disease Foundation just to stand up. I know that Paul's here. So if anyone has any questions about the merger, and Robin Elliott is here as well, please to come see us. I'm sorry for that commercial, but it's such a big, exciting, awesome thing that I had to take a moment and just say that. So, okay, so now, what I'm supposed to be talking about. First of all, I'm sure a number of you in the room are familiar with the Parkinson's Disease Foundation. We've been around since 1957, have expended a significant amount of resources on funding really world-class scientists, and then also investing resources in education and advocacy work. And it was really interesting in listening to people talk today. Something that we've been focusing on, because we're a smaller foundation, our budget is about $10 million, is to focus on funding leaders. We recognize that we can't do everything, and so we engaged in a strategic plan about a year ago and said, you know, how can we get the biggest bang for our buck? And we focus on funding healthcare leaders, and you heard Gwen talk about the program and our collaboration, research leaders, and also I'll use the word patient leaders, but leaders within the Parkinson's community. And what I'm going to be focusing on is the third component of this. So for the past decade, the Parkinson's Disease Foundation has really recognized that people with Parkinson's need to be at the table as equal partners and collaborators in all of our work as it relates to research, care, and support. So, I mean, these are the four programs that fit under that portfolio for us. And as Malcolm mentioned, the one that I'm going to be focusing on is our PAIR program. I also, at the end of the slide deck, are a list of the abstracts that we have here at the World Parkinson Congress that touch on these other initiatives. And I encourage you to ask me about them or drop by our booth and also talk to people that will be staffing the abstracts. But in relation to the PAIR program and why this has really been part of the Parkinson's Disease Foundation DNA is that we really believe, you know, in our hearts that it's essential for people with Parkinson's to be at the table, as I mentioned earlier, because they're the ultimate stakeholders. You know, sometimes I equate this to our consumer society and how, you know, when it comes to toothpaste or other types of consumer goods, we analyze things, we do market research, we talk to the consumers. But when it comes to things like care and treatments for disease, such as Parkinson's, we don't do that work. And you know, the time has come for us to stop looking at people with disease as the passive receptors of what we decide to provide them, and to bring them to the table and have conversations from the very beginning. So, I was asked to talk about 4 lessons that we've learned from our work with our Parkinson's Advocates and Research Program, and I'll get into a little more detail about the program, throughout my comments, are these 4 things. And we learned a lot of other things over the last 10 years, but these are core that I wanted to share with you. And one is that you need to recognize that authentic collaboration begins at home, and I'll talk about that in more detail. 2, dedicate resources to training and support. 3, align the right people with the right projects. And 4, address cultural barriers and incentives that hinder success. So, okay. And something else I wanted to mention is that when we talk about engagement and collaboration with people with Parkinson's, this is a definition that I found that spoke to me, and it's that engagement is the process of building relationships with people and putting those relationships to work to accomplish a goal. We're not inviting people with Parkinson's and care partners to work with us because it feels good. We're doing it because we want everyone to be focusing on the end game, and that's to improve access to therapies that are made available faster and improve care. I won't get into this too much, but this really, again, talks about the DNA of the Parkinson's Disease Foundation and our philosophy in bringing together all stakeholders. And so lesson number 1, authentic collaboration begins at home. Something that we've learned when we launched the program, again, as I mentioned about 10 years ago, is that we brought people in, people with Parkinson's and care partners, and we talked to them about the importance of clinical research and about getting involved. But what we realized is that was only one piece of the issue. It's not just about recruitment for clinical research. It's about making sure that you have people with Parkinson's engaged in deciding what the research priorities are, having them involved. If you notice some of the pieces here, in the grant review committee at the Parkinson's Disease Foundation, making sure that, talk a little bit about this program in a moment. We have something called the Community Choice Award, where we ask the community to tell us what their needs and priorities are, and then we bring together a roundtable of researchers with people with Parkinson's to start to tease out that issue, and then we fund research in that area. So, we've been learning as an organization how to walk the walk and talk the talk. And again, as I said, it's more than just saying, we want you to come in, we want to train you about the importance of participating in clinical research. And it's important to be honest with yourself and recognize when you're not doing a good job as well. And so, for example, within our organization, I'm the patient engagement person, and I may bug my colleague in research a little bit and say, we're doing all this world work in the external community, but internally, we really need to make sure that there's a person with PD that's on our scientific advisory board. And calling yourself internally is really critical. So the second lesson has to do with dedicating resources, training, and support. So, this picture is kind of funny, I guess, but the point here is that you really need to spend the time providing people with the information they need and the backup they need if you're going to ask them to engage, in this instance, in taking part in clinical research decision making and helping and sitting at the table with researchers. And you need to ensure that people have, again, skills, training, and backup. And one of the ways that we do that is through our Pair Learning Institute. The Pair Learning Institute is a 3-day training where we select individuals through an application process, about 25 individuals from around the country, and they come together, and we have experts from all over the country talk with them about what's in the research pipeline, how to evaluate scientific research, how to be an advocate in your own community, let's see, a little bit on biostatistics. And at the end of that, these individuals make a commitment to go out into their communities and work with researchers on the local level, regionally, and they may work on the national level as well. And something else that I'd like to talk about is that it's more than just a training. That we all feel great when people get together for 3 days and it's a wonderful experience, but the key is really what people do after the fact, and ensuring as an organization that you have the resources there to help support them, particularly when you're working in an area that is so kind of culturally new, and I'll talk about this in a few moments, that patient engagement isn't something that comes automatically to other stakeholders within the Parkinson space. And so you really need to make sure that you have staff in place to provide the advocates that you're asking in to do this good work with the skills, resources, and make connections. So here, the ways that we've done that is that we pull together people on a monthly phone call to share information. And I carefully say current practices because we don't know what best practices are within the patient engagement space right now, and I think we have to be honest about that. I think also too, we do a lot of one-on-one technical assistance. What we've found is that we will train these individuals, but then what they need is someone to engage in matchmaking for them. You really need to ensure that you have someone that will pick up the phone and call a researcher and say, hey, hey Joe, I have Sue here, and she's really interested in looking at issues related to like dyskinesia, and I hear that you're engaging in a study at your institution. Do you think you may be able to utilize her and we can plug her in some way? And not all advocates need that type of high touch, but for the program to be successful, you need to ensure that you're going to provide that. And the last piece here is what we've found over the years, and even so more recently, is that it's not only the advocates that are engaged, but it's the PDF staff that are engaged as well. We're at the point where we are actually experts in the field in patient engagement, and we are getting phone calls from pharmaceutical companies. We are getting phone calls from the FDA. We are getting phone calls from NINDS, and they're asking us for our help in framing their own patient engagement work. And so that's kind of a fifth lesson is don't sell your internal professional staff resources short, and to recognize the value add within the larger community. So lesson number 3, align the right people with the right projects. Something that we've learned is that one size does not fit all. And when we first started, we brought people in, we trained folks, and then we said, okay, go out and do whatever you want to do, and these are some options. And we found that some people are great educators. They love to go out and talk to support group leaders about the importance of clinical research and study participation. Some people are really wonky, and they are great people to attend an FDA commissioner's meeting and talk about the needs and priorities of people with Parkinson's. And that everyone has their own skill set. And so that's another thing that we've learned is to really do have a sound evaluation of all of our advocates and then figure out where they will succeed. But then another piece is to recognize that you need to be honest with yourself about what your needs are and how that aligns with the goals of your organization. Because as I said earlier, it's not just to make everybody happy. If the goals of your organization are to move to, let's say, focus on the needs and priorities of people with Parkinson's and make sure that you're driving research in that way, then you need to ensure that your advocates are aligned with what your outcome is. And to be a little hard about it sometimes. That's what we've found that there are many people that wish to participate in our program, but that we may not accept everyone. Okay, so this is lesson 3, an example within a clinical study that was funded by NINDS, and it just gives you 3 different touch points of the same study to give you an example of the different skill sets that might be utilized within the pool of advocates. So again, some people are going to be great looking at some of them serve on the advisory committee for the study. And so that's one type of person. Someone else is on the ground working on recruitment, and that's another type of person. Okay, number 4, address the cultural barriers and incentives that hinder success. We've heard people talk about that during the course of the day-to-day, that we have the silos, the research silo and the patient silo, and I think we have to be very mindful of the different incentives and motivators that are in play and the cultural, and when I say cultural, I mean institutional culture that currently exists, and that the work that we're doing around patient engagement and bringing people with Parkinson's to the table as collaborators really touches on this piece in the largest way, in my opinion. And it's recognizing that as a researcher, your incentive may be to work on certain projects that are funded by NINDS, let's say, or another institution, and perhaps that's not exactly aligned with the needs and priorities of people with PD. And it's having those open dialogues and trying to get people to understand that we both want to be going to this in the same direction, and understanding that there are competing incentives in place. Does that make sense? I'm not sure. That was a little wandering on my end, but I think that's something that, so some of the ways that we've addressed this, because we recognize that we had all these people with PD that wanted to engage, but we had all these researchers that didn't know how to work with them. So we recently have been making this shift and saying, okay, what can we do to create a climate that is more aligned with where we want to go and where we think we'll be more successful in attaining our goals. And so one is something we call our leadership awards, where we provide funding to researchers who are demonstrating that they're authentically collaborating with people with Parkinson's. They bring a research idea to us, they demonstrate that they have buy-in, and then they move forward on certain projects. And these are some examples of those. And again, another example is our Community Choice Research Award that I mentioned a little while ago. A commercial for that is, while you're at the WPC, come to our booth. We are asking people to give us their ideas in terms of what they think are under-researched needs and priorities, and then we'll be picking, I think, 2 future Community Choice Research Awards from that. But again, the importance to this in terms of the cultural component is that we are forcing people to get together and talk about issues and share ideas. We're forcing the research community to collaborate and to also start to recognize the value. And that's what you'll see here in this slide, is that we're engaged in surveys to get a sense as to whether or not we're moving the needle in terms of how researchers perceive value when it comes to engaging people with Parkinson's. And this is what we found, that after one of these, our Community Choice Research Award conferences, we found that 100% felt that inclusion of patients added value to the meeting. And that's 100% felt that the patient input enriched the discussion. 78% felt that they're more likely to include patients in scientific conversations. And so, this gives you a sense of how we think we're adding value to the larger landscape and trying to, forge collaborations. Let's see. Okay, so just a couple slides to wind up. And I share this because these are quotes from researchers, and it just shows that shift that occurs when they have the opportunity to sit down and talk with people with PD, and it changes their thinking around in relation to how they do their work. And I won't read the quote unless anyone in the back needs me to read it, but I think folks can see. And then here's another from Dr. Kumar. And again, this is what we are trying to attain, is you have someone who looks at an individual as a patient. That's the dynamic, and that's the relationship. And you see that has changed. And now Diane is a colleague. Diane has worked with Rajiv as, they've worked together as co-PIs on clinical research. And that's really where that's the place where we want to get to with our work with the Parkinson's Advocates and Research Program. This is just a summary of what I said earlier, that I think sometimes we focus so much on metrics and numbers, and they're critical and we collect those. But I think we need to recognize that what we're doing is we're really trying to change culture and change the foundation that we're all working in, and that we should honor the work that's being done in that area. And those are the 4 that I talked about in terms of the lessons that I've touched upon. And then these are the abstracts that we have available. While we're here at the WPC, on the Community Choice Research Award, also one that I've talked about a little bit on study sponsors and our work with pharma companies. The third is straight on the Patient Advocates and Research Program, and the last is on our Women MPD initiative. So thank you very much. Thank you.